To start off, I would love to understand kind of just 5,000 foot view on what your philosophy is, Dr. Welchie and Christine, on helping people move forward with treatment.
We gather as much information that your company can provide to us, right? So I reach out to my patients, I kind of get their pain points, right? So what is bothering you? Do you currently have a CPAP? Are you just snoring? Like basically, what are your specific pain points? What is really bringing you to contact us? Then we get them in the office, kind of go over everything. I think I'm a very show and tell kind of person. So I can talk to anybody all day long, but I really like to show people what the device looks like comparison to we have a sample of like a CPAP machine or a mask at least, and to show the differences in between the two, because I feel like seeing is believing. I know that's a very old saying, but it really is true. I feel like once you see what the device can look like in comparison, especially if you have a CPAP machine, it makes the world of difference. So once we get them in here, I feel like that's really when everything can kind of become more realistic, when they speak to doctor, when they realize that we're real people, that this is a real option for them. That's when reality hits. And that's pretty much, to be honest with you, I feel, not to sound cocky, but I feel like if we can get them in here and actually get to meet us and get us to explain the process of everything, I feel like that's really key, is to get them into the office.